What is cognitive behavioral therapy? Cognitive behavioral therapy (CBT) is a form of psychological treatment that has been demonstrated to be effective for a range of problems including depression, alcohol, anxiety disorders and drug use problems, marital problems, eating disorders and severe mental illness. Numerous research studies suggest that CBT leads to significant improvement in functioning and quality of life. In many studies, CBT has been demonstrated to be as effective as, or more effective than, other forms of psychological therapy or psychiatric medications. Cognitive behavioral therapy for anxiety. Cognitive behavioral therapy (CBT) is the most widely used therapy for anxiety disorders. Research has shown it to be effective in the treatment of panic disorder, phobias, social anxiety disorder, and generalized anxiety disorder, among many other conditions. CBT addresses negative patterns and distortions in the way we look at the world and ourselves. As the name suggests, this involves two main components. Cognitive therapy examines how negative thoughts, or cognitions, contribute to anxiety. Behavior therapy examines how you behave and react in situations that trigger anxiety. The basic premise of CBT is that our thoughts, not external events, affect the way we feel. In other words, it's not the situation you're in that determines how you feel, but your perception of the situation. Cognitive behavioral therapy for anxiety and depression. Depression is a persistent feeling of sadness over a period of weeks, months, and sometimes years. It can present itself in many different ways between individuals, but symptoms can include low mood, loss of interest in hobbies, hopelessness, feeling tearful, fatigue, loss of appetite, decreased libido, physical aches and pains. Changing negative thinking patterns is important in CBT for depression. Recurring negative thoughts can be gradually replaced with more realistic and more positive thoughts and beliefs, and CBT can also help a patient be more aware of what may trigger negative thinking and remind themselves of the benefits they will get from engaging in positive thinking and behaviors so they can apply these new, healthy behaviors throughout their daily life. CBT can also help with suicidal thoughts, with patients learning how to recognize negative spirals into suicidal thoughts and behaviors, and developing personal strategies to calm themselves and abstain from harmful or potentially life-threatening behavior. Cognitive behavioral therapy for social anxiety. In cognitive behavioral therapy for social anxiety, Amy Wenzel demonstrates the execution of this system of psychotherapy, which is based on the premise that inaccurate and unhelpful ways of thinking about oneself, the world, and the future have the potential to cause, exacerbate, and maintain emotional distress. Cognitive behavioral therapy's efficacy has been demonstrated extensively in empirical studies for a wide range of clinical presentations, including depression, anxiety, anger, addictions, personality disorders, and adjustment to medical illness. Cognitive behavioral therapy for social anxiety disorder. Social anxiety disorder (SAD) is commonly treated with cognitive behavioral therapy (CBT), a form of therapy that first became popular in the 1980s and 1990s for treating anxiety disorders. Research has shown that CBT is a form of therapy that reliably helps in overcoming clinical anxiety disorders. Cognitive behavioral therapy is not one set method but rather a combination of various techniques that depend on the disorder being treated. For example, CBT for treating depression will be different from CBT for treating SAD or other anxiety disorders. Because there are so many different techniques, it is important that your therapist is experienced in using CBT for treating social anxiety disorder, and knows which particular techniques are most effective for this disorder. Goals of CBT for social anxiety disorder. One of the central goals of CBT is to identify irrational beliefs and thought patterns and replace them with more realistic views. As part of the therapy process, you will work on a number of problem areas including, 1. Misperceptions you may have about your abilities and self-worth. 2. guilt, embarrassment, or anger over past situations. 3. How to be more assertive. 4. Tackling perfectionism and being more realistic. 5. Dealing with procrastination related to social anxiety. Your CBT therapy sessions may feel somewhat like a student-teacher relationship. The therapist will take the role of a teacher, outlining concepts and helping you on a path of self-discovery and change. You will also be assigned homework assignments that are key to making progress. Thanks for reaching the end of our video. Subscribe to our channel so you don't miss any of our future videos. Also, if possible, like, comment and share with all your friends. Your help will be of vital importance for our growth. Thanks and see you later.